I'll just save it as a file, and then I can email it to y'all if you need it. Just email me, say, hey, I want that, or text me over the weekend, because I don't check my physical email. I wanna get it. Okay, so lymphangitis, like I said, where something that's must be draining through your body. You know, those lymph nodes, you know, there's something that's swollen, it's blocked, so it's swollen, it's red, you'll see red streaks in that area. Sometimes it's in the groin or in the underarm area. They might have when you got infection, you have fever, chills, all that kind of stuff. Just like if you were any kind of infection. We just reviewing lymphangitis. Okay. So what do you do when you have some kind of staph or strep infection? You always get what from the doctor? Antibiotics. So that's the treatment for lymphangitis. You get antibiotics, anti-inflammatory. That's like Tylenol, ibuprofen, Aleve, something like that. And warm soaps. You know, that helps bring it all to open it up and dilate. Warm dilate. Opens things up. So if you've got an area that's blocked, you get a warm, hot washcloth, and put it on there, and it dilates that tissue, and then it can drain out and get back into the system and clear out like it's supposed to. Okay? Does that make sense? So you're gonna rest, give them antibiotics. Remember what we said, any extremity that's swollen, we elevate. Because that lets that fluid get back in easier. It helps it get done faster. Meds and warm soaps, okay? So lymphangitis. It was on your syllabus and we just kind of went through it real quick again, so I want to make sure y'all got that. In case you put some question on there. I had to look for it. Did she review this?
Yeah.
Okay, so lymphedema is kind of the same thing. We're still in that lymphatic system. That's the gutters on your house. It's collecting all the garbage and they drain it out, all the fluid and junk. Okay, so this is just lymphedema. Edema means fluid or swelling. So if you have edema, lymphedema is just accumulation of that lymphatic fluid in the soft tissue. Now, instead of just staying in that vessel and being clogged up in that lymph vessel, it's gone out into your skin, into your interstitial tissue. So it's swollen. And that's when you have the edema in the extremities. Okay? Remember we talked about a lady, if she had a mastectomy, part of that breast is lymph tissue. So if you scoop all that out, that's like taking half the gutters off of the house. The water doesn't have nowhere to go, right? So it just goes out into the air, but it would go out into your skin. And so that's when you'll see all that swelling and edema in their tissue. And what was the treatment we said?
Compression.
Compression, massage. So like they'll give them a compression, like a sports bra or a compression vest, but you don't want to wear tight clothes because like TED hose that you put on people when they're swollen in their legs, a compression vest for a mastectomy patient, it has a little bit of elastic, right? So it'll give a little, but clothes don't usually give. And so if they're starting to swell, that sleeve or whatever that shirt is on, it gets cut off. So you want compression type material that can stretch with them, but it's still give them support, but not tight clothes. Does that make sense? They're gonna have a lot of swelling, pain, so we're gonna do what? Elevate it, give them that compression bandages, the compression clothing, elastic sleeves so that you can stretch with them. And what kind of diet do you want? Anybody that's having swelling. Low sodium. Always. The salt, water follows salt. And it holds it. So always low salt. Okay. Elevate it. Massage that fluid back towards the trunk, the center of the body to get it flowing where it needs to go. So everybody good on lymphangitis and lymphedema? We're kind of in. I just want to make sure y'all got those. I think y'all feel good with me. What about DIC? Any questions on DIC?
D-dimer is the test, right?
D-dimer is the test. You want to always make sure that you're compressing, putting pressure down. And immediately you want to start giving them some platelets. Platelets are your blood clots. That's what clots off that bleeding. So, where do you see DIC at? That's most common. anything that's made their body bleed suddenly or miscarriage. Something's happening where the body's trying to, the rupture of the placenta, where the placenta just rips out unexpectedly and it's not time to give birth, and all that blood is in there, you're bleeding, so your platelets rush to stop the bleeding. All of them come too much, too fast, and you don't have anything left. So then you start really bleeding. So D-dimer's a test, give them platelets, and you monitor what? When anybody's losing volume of fluid, blood pressure, always. You don't want them to play out. Okay, pancytopenia, that was on the syllabus, and there wasn't really a slide for that, so I just want to make sure you understand what that is. It's not a disease process itself, it's just a symptom kind of the disease process. It means low red blood cells, low white blood cells, and low platelets. They're low on all of that. And that can happen in anemia, all the different blood diseases we were talking about, where they're bleeding out, hemophilia, things like that. So pancytopenia is just a symptom. It means, remember, cyto means cell, penia means small amount, and pan means all. So they're low amounts of all of their cells. They don't have a lot of red blood cells, they're low white blood cells, and platelets. This happens like in the cancer patients too, because remember we're giving chemo. Did she say multiple myeloma was going to test? Okay. Just know in case you come across that on your ATI or your board, that's like a buildup of cells in the down there that produces tumors. So it gets on the back, on the spine, and it's real painful. So myeloma means tumor on the back. Usually it's in 45 to 65-year-olds, kind of a slow growing tumor. Starts in the back. You gotta be real careful with them. You're just thinking, if your back has a tumor on it, so you gotta be real slow and real careful with the pain. Are y'all good on those? Feel good about it? Any questions on those? What about neutropenia, leukemia? Y'all have that kind of straight in your head? Neutropenia is just a low amount of neutrophils, which are the white blood cells. And white blood cells eat up bacteria infection. So if you have low white blood cells that eat up infection, what are you highest risk for? Infection. So always, watch them for that. Watch their blood count, white blood count. Leukemia, kind of the same thing. That page 1511 is where they have all the chronic and acute. There's 4 kinds. And the chronic ones are usually in older adults. And then the acute ones are in kids. It can be an adult too, but if it's acute, you want to treat it fast and aggressive. Chemos, bone marrow transplant, that kind of stuff. Any questions on any of this stuff we've had? I think y'all have got a real good hold on it. If you're studying and think about something, send me a text if you have a question. Did the pictures help?
Don't forget to send that camera. Can I tell you a question? That paper that Monique just passed back to y'all, they make the questions that y'all gotta send to that lady. The lady gonna see the questions she wants to answer. Just in case y'all confused, like how you do a regular college review, and it's the paper that she, you know what I'm saying? When you do an ATI, you know she passed them back to you, let you know what the score and stuff was. That's not the question. Oh, yeah. Yeah. Don't be like me. Do both. Yeah, like it'll tell you, it'll tell you the exact chapter. Yeah,
right. I got 19 questions, right? They're gonna go in order. one of my questions may say something like, actually, the first question is name sick tags that will be designated to assistant personnel. You go right there. So you just go to 106 and right there saying five. Oh.
Are you struggling?
No. I'm fixing to play dodgeball.
Oh, you're playing the I thought you were supposed to take
Well, I probably need to be because it's on insurance on. I'm not supposed to be. Okay, y'all ready to do something fun? Friday, thank God it's here. Remember, I got the recording if you need something. I got it working, so when we get back, we'll have lectures. We're going to put the PowerPoints hopefully this afternoon for next week on. So if you have time to look at anyone, look at them or study, they'll be there. All right, got my number.
Let's play.
Let's do this. We're going to do extreme trivia dodgeball. If you want, and I am a good aim. Okay, so, but Sequise play volleyball, so she might kill us all.
Are you a baseball mom? I'm a baseball mom.
I am a baseball mom. My son started when he was 5 and he played till he was 7. So what we're gonna do, I did this with my other class, like to review, and they liked it. They said better than me just sitting there and talking. I mean, you know, I'll try that. So what we'll do is kind of like you get to pick the questions. So I'll give you the ball first. You get to pick who you want the question to go to, and then you get to look through your notes or your book or whatever and ask them a question. Okay.
From the review that you gave us yesterday, y'all.
So I have some questions. What would you rather do? You want me to ask a question, Joe? You want to ask me? Okay, we'll just give you the option. If you want me to ask, I have some questions, and if not, then you can pick your own.
Ask us questions. Ask us questions that we like it.
Actually, you're always looking for a loophole.
You hear me?
What?
Ask us questions that we like it.
Here. Or the back of
You
your
already have the test. Ask questions.
Yeah, do
Well,
that.
she said, well, I didn't ask her, did she review the test?
She did.
Okay, well then, did y'all do good on it?
No, I didn't have time.
I did
to
not.
do that.
Next Thursday, we'll do that. I'll get the test and we'll do another, we'll split in teams. And maybe the team, we can do like a prize or something for the team. 10 points. Alright, so who wants to go first? Alright, you ready? Alright.
What I do? I'm gonna throw it.
I'm gonna ask you a question and then you get to pick who you want to answer.
Don't ask me this hard.
Okay, y'all ready? Name me one, or actually name me 2 nursing measures or precautions you would use if your patient had hemophilia. Think about what it is. Talk it out if you need to. Say it out loud.
You don't have to answer. Oh, I gotta give the question to somebody else?
No, that's you first.
No, you. Go ahead, don't. No, okay, shut up. I know what to do.
Hemophilia, what is it? Tell me what it is.
It's blood.
You're right. That's right.
I don't know. I don't know.
Alright, you can get a lifeline.
Can I-
Come
okay.
lifeline.
Oh, go, Ashley, go. You ain't supposed to read that.
Yeah, it's supposed to be from memory, but whatever. Tell us what it is.
What did you want the intervention?
Yeah, what is hemophilia first? What is it?
It's blood clotting factor.
That's where it's absent.
They don't have any, they don't have any blood clotting, so what are they gonna do? They bleed. They bleed. So, well, you can't keep giving lifelines.
Read the interventions, Ashley.
What are the interventions? What do you do if somebody's bleeding?
Pressure.
Pressure. Y'all help her out, audience.
Pressure.
What else? Good. Did they?
Monitor their vital signs and laboratory report, apply cold pressure, assess for anxiety, shock, disorientation.
Look at your little picture.
Yeah,
Yeah,
we got that old dude. I'm gonna go look at him.
Look at Randy. Do we keep giving them their blood thinners? No. Do we want them to use a regular razor to shave with? No, because we don't want them to bleed. And all this stuff you said too. All right. Soft toothbrushes. Watch for bleeding and hemorrhaging. Don't use a lot of extra needles and stuff. We don't want to give them extra holes for them to bleed out of. Okay, Ashley. You get to pick somebody.
The question.
If it's about Jimmy, I wanna know.
Oh.
Oh, no.
Alright.
The
demanding.
Nation, you're rude.
Okay, so please. What compound in the blood carries oxygen to the cells? Red blood cells, but what's in it that carries oxygen? What does oxygen stick to? Yes. Pick a new person.
Chelsea.
Uh-oh, Chelsea.
Turn around, 'cause I want you to knock your head, you will get mad, and then
Alright.
Go, bestie.
Universal donor type of blood is what?
What? Bring us down slow.
Oh,
he sounds so
type O. Good.
That's what I said.
The universal donor.
no way you didn't give me that.
You know, I got my pets, my favorites. Alright, pick somebody.
Oh, so you give her the evil. She's gonna be your favorite. It's so hard.
You better
It's
not my fault. You said it's not
She doesn't wanna do it.
Oh, she on the Spanish road today. Spanish out one.
Alright, your patient has these following symptoms. I want you to tell me what they are. Fatigue, shortness of breath, pale, anemia. Good. Alright, you get to pick somebody. Oh! What is a patient with pernicious anemia lacking?
B12.
Oh,
No.
she knows that one. She wants
You gotta, if you answer and they ain't supposed to get answered, you gotta give
You can give a lifeline if you don't know. You can use a lifeline. Pernicious anemia, they're missing something.
Oh, it's the.
B12. So now give that to them. Whoever you want to. They're missing the intrinsic factor. You're right. And they can't get the B12. But for the test purposes, yes, they are missing the intrinsic factor. The treatment is B12 shots. You're right. All right, you ready? Oh, nay. Let me put some good one up.
Oh, nay.
Let me see. Which lab test indicates, is a strong indicator of DIC? Yes. D-dimer. You ready? Okay. Tell me where the spleen is located and what is its function?
Left side.
Left side, upper abdomen. Remember we said we had to really dig in there? And it stores blood. Good. So you get to pick somebody.
1 liter of blood.
Is there such a thing as wandering spleen?
I sat on this housewife the other day and I
It's wandering, I wonder where it's going.
well, that's what I said. I was like, what is he doing?
When's it coming back? Blood. Okay. Who's got it? Your patient has iron deficiency anemia. You are discharging her. Send in her home. What are some of the teaching methods you would use on her? What would you teach her about her new diagnosis?
To increase red meats, increase green food, take food to rest.
That's good. Anybody got any more? Your iron deficient anemia patient. What else do you tell them to do? Anything else? She said rest. Diet high in iron. What else can we do for an iron deficient person? Keep them warm. Good. What do they need to do when they go home though? What is their wanna build it back up? Okay, good. Do we need to tell them to keep eating dirt?
You can let them know that.
Yeah. Can they eat the dirt? They eat it, but it's, I mean, it does no good for their body. It's just like putting nothing in your body. It sucks out all of the, what little bit they had, it just takes even more. It's more damaging. So, they don't need to eat it. Plus it has bacteria in it.
And my mama eat toilet dish.
That's pasta. Y'all are all anemic.
Yeah. Whole family.
Squad.
Okay, who's got it? Okay, let me think of a good one. These are too easy. Y'all are going through these too fast.
This is what we need right here. This is what we're talking about.
What is a symptom? Okay. What is a symptom on your sickle cell patient that you notice while you're doing your assessment? Pain. What else? Well, you can note it. You can say, I mean, if there's, you know, facial growths or they're guarded.
This, they got to.
But what's something physical that you would see on a sickle cell patient? They're going to be dehydrated, so you notice those signs. Clubbing of their fingers. Remember they had the big ET finger? No, because it's caused from hypoxia. And they're hypoxic because they don't have those red blood cells carrying their oxygen. Okay? Alright.
Yeah.
I didn't write my nurse on the back to do it. I'm not going to do it. I'm checking.
Some of it's not stuff we went over. Like drug tests or anything.
Number 4. Arterial disease? Oh, which factor?
Who's got it? Ready? You got it? Tell me something you could do. First of all, tell me who's at higher risk for hemophilia? Male. Tell me something you could do for a hemophilia, like as far as your nursing measures.
Away from sharp objects, don't needle sticks.
Yeah, say it loud. What?
Eating needle sticks.
Is that Randy? Yeah, this is our hemophilia.
Don't eat razors.
Yeah, but similar to Randy. Would you notice, or would he say, if he was a hemophiliac, which means they're bleeding, remember? They've got that inherited blood disorder and they bleed really good, they don't clot good. What if he says, my joints are hurting? Would you expect that in a hemophiliac? Yes. They bleed into their joints, it's real painful. Do they have good hygiene?
No, because all brush they change it.
It hurts to brush, so they don't brush. Okay. Would you expect normal bowel movements or tarry, dark bowel movements?
Don't push with the valve.
Would they, if they throw up and they say, oh my gosh, it looks like I have coffee grounds in my vomit, no, because they're bleeding all the time, they don't clot, so they always have a little bit of blood in their GI tract. Okay, good. All right, pick somebody. Y'all are not even fun. You're supposed to be tagging people with it. It's fine. Just take your issues day out.
Wait, the goose, whoever the goose got, he get.
What? Okay, I'm gonna give you a hard one because I know you took notes.
Well, get up and run, I just goosed you.
You remember in the notes we were talking about on sickle cell, and it can be inherited, right? what was the what was it called if they're trying to see how if they're sickle cell positive, what is that called? That'll, on my blood work, it'll show up positive. There's two of them. I can word this better. My question's not good. When they test positive for sickle cell, you've got two parents, two that are carriers, and they test positive for sickle cell. Two identical genes from each parent makes them have sickle cell. What's that called? Starts with an H. Give your lifeline.
Homozygous.
Yes, homozygous. That was really a random fact, but it might show up. Homozygous is when the parents are, carriers, and then the child develops that sickle cell because it's hereditary. Heterozygous means one had it, one didn't, so you're a carrier. Only a carrier didn't show up. You gotta have both. Remember, both parents have to have the genes to make that sickle cell patient. We talk about genetic testing and all that kind of stuff. Remember that? Alright. Who you gonna pick?
Who took him?
Who am I going to pick?
Hey, who took him?
Amanda.
She just won.
Yeah, she already had one.
Oh. Well. Regina.
No. Nikki.
That's up to
Daniqua. Give me the ball. Give me the ball. Daniqua, you better catch. Your man. I throw too far,
Okay.
so I tried to throw soft.
What does thrombocytopenia mean?
Clotting, blood, small.
So, good. You're right. So what does that mean?
Blood is not too small.
Small amount of clotting cells. Low platelets. You have a small amount of the thrombos or the clotting cells. So you have low platelets. Because your clotting cells are your platelets. Good. Way to break it down. Do y'all need that other fan on? We can turn that other fan on.
Why y'all so be so
Very
hot?
I don't know y'all's name and I want to just have something about.
So you.
That's what you're giving.
Okay, we just said thrombocytopenia was a small amount of blood, platelets. You know what that means? So tell me some of the signs and symptoms of somebody with thrombocytopenia. They don't have a lot of platelets. Think about that. That's what happens. So when they come in and they may have what? Bleeding or
They're gonna be petechiae and ectomyces.
bruising and petechiae. Because they're not bleeding like DIC, they're not severely bleeding, it's just a little bit all the time. So they'll have the bruises really easy, almost like somebody that's on blood thinners. They'll be bruised really easy, they'll have a petechiae, they might have nosebleeds really easy. You can stop it and control it. DIC, you can't control it, you have to give them a Yes.
I'm gonna throw it to Donna. Donna's getting this. Donna. 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 Can y'all hand that back to Donna, please?
Well,
Please just make her play. That's okay. I got your back, Donna, if it's easy.
Oh, if it's easy.
I can only do so much, you know.
Alright, so if you had thrombocytopenia, and they come in and now you know their symptoms, what is the treatment for that? As a nurse, what would you do for them?
I'm looking at. Prevent infection, you want to prevent infection?
Okay, you do, but if they're bleeding, right then,
Verbal and blood transfusion.
Yeah, thrombocytopenia, you do use
steroids help with inflammation, and so that helps give them that. But then also you could do, treat the underlying cause. If they have low platelets, what do you need to give them? Platelets. Something that, and so sometimes if it's bad enough, like they'll do a PTT lab work, and that's to check to see their platelet count, and if it's low enough, the doctor will order platelets. But you can give them steroids too. Alright, pick somebody.
That's Jay.
Hey.
Oh, yeah, y'all have to get
You're playing.
But I was like, oh, because
Yes, the hot shot, no, is it under, files?
what you
Put it on there. I'm making them in the wrong place. Let me go back.
Are you serious?
It's the
Jay's
number.
asking y'all for your lifeline.
32 questions.
Your lifeline. Ready? Okay, tell me what erythrocytes are.
Ooh.
Red blood cells. Good. Remember ERY.
Wrong.
Red blood cells. Well, they can all be hard, so. Okay, now, if you know what a red blood cell is, we talked about it, they carry oxygen, right?
Yeah.
Where do you go to get red blood cells? If you're,
Long bone.
am I right?
Okay.
Bone marrow,
Long bone.
Should not bring.
Oh, that would be a good song to remember that one.
No, you sound like a slave.
I know,
They ain't gonna turn the herb because they said if they tell it, then they ain't
I am just waiting, we got our fans on. Are you ready?
You sound like a slave.
You remember?
Get my money.
Is y'all really that hot? I'm just really curious.
Yeah, it's hot. It's no.
Having a hot flash. Girl, go put some water on the Water, hot water.
What is the test, the lab test that the doctor would order to check to see if somebody's anemic?
AGB.
You're not the lifeline yet.
Actually, a different question.
Hemoglobin is inaccurate. H and H. Okay? See somebody. Pick somebody good. What is the normal range?
Oh, no, don't ask, no.
For hemoglobin. Yeah, ladies, let's do ladies, cause we're, that's where usually everything is. Ladies, and it's gonna be different on every lab.
When the ATI lady comes, she gonna get
It's gonna be different. Everybody's are off a little, but that's on a year range. If you know where it's supposed to be, and it's either really way high or really way low, then you know. You're okay.
Yeah, just
Average.
12 to 18 for men and women.
12 to 18, think about, that's when, this is what I remember, that's when girls start their period. So that's when girls start their blood.
18 is when you work.
That's how you, and a man's hemoglobin is 14 to 18. Just average, it might be a little bit more or less on the on where you look. But that's an average, okay? Hematocrit just measures the total amount of their blood. It's not as important as the hemoglobin. Hemoglobin compares our oxygen, remember? So bottom line is we want to know how much oxygen we got left. Okay. Alright, you ready? Maybe I'll pick it.
Regina, so again?
Okay. What does leukocyte mean? That's it. You're not gonna put lifeline?
I have no idea.
Remember, site means site means cell. And leukocyte, I think of white, like a white leukemia. Somebody said so. White cells. What are white blood cells?
Oh, okay.
That's hard. She's like, please don't.
What? Don't start with that Mr. Getty stuff.
Steve Mark too hit her.
What is the normal lab value for white blood cells? For leukocytes? White blood cells, what's the normal range? 5 to 10,000. What's the normal platelet?
That one,
150 to 300. Because I think you need more platelets because you're bleeding, so the number's higher.
What is that?
150 to 300, 150,000 to 300,000 platelets.
Okay, what's a core?
What's the name?
It's what's a core?
Are you talking about?
Yeah, 150, well, that's 154, so you say 130.
every day?
Perfect. This is a perfect pH water.
Really?
Are you in the wind?
Every book and every lab report is a little off. 150 to 300.
You got, I don't know, she's
But white blood cells,
You got that.
5 to 10,000.
yeah, but he don't get that right.
I don't know how you do that.
5,000.
Okay. I mean, girl. What?
Where is the ball?
Who's holding ball?
Oh.
Did I say?
Hide yourself.
Sorry. Okay, what, we talked about who can, the universal donor for blood is type O. Who's the universal recipient?
Oh, I know.
AB. Good. They can get anytime. Because AB is like, it's a good mixture of everything. It'll take anything.
Throw the ball
Okay,
up.
ready? It's gonna be easy.
Throw the ball up.
I gave you a visual. If your mama comes in and she is RH negative, and she says, I'm pregnant, and you check, and her baby is RH positive, what do we need to do? Yeah, is that, I wrote it on the bottom of that yellow thing, or the picture I gave this morning.
And when do you give 28 weeks
To give that injection, and that helps her prevent getting rid of her baby. Like the body wants to reject it. So if you give her that injection, her body is like, oh, okay, I'll keep it now. I realize what it is.
It's a Rogaine.
Rogaine. And then they, when did you say, Ashley? Say it again when they have to get that shot.
28 weeks and 72 hours after delivery.
Because if they don't get that shot after delivery, that's when they can go into DIC too. Because their body's still got the baby's blood circulating in it, and in the placenta and stuff, and it can make them bleed to death.
We want to ask you a question.
Oh, God.
Throw the ball.
All right.
Alex,
No, we need some answers.
okay.
Why would you say that I haven't bled in months?
Okay.
Don't say that. Don't say that.
What do patients have to do prior to a bone marrow transplant?
Total eradication.
Yeah.
lay on the unaffected side and expose the iliac.
What was your question?
Iliac.
Good.
We was asking her to answer.
Okay, I'm not an expert, but I would guess they need to stop any kind of blood thinners. That's anything for any surgery.
Let me tell you what's gonna be on the chest. I mean, let me answer that question so y'all will
Okay,
get
go
it.
ahead.
Yeah, no.
Oh, I think I got that copy too, Donna. I need that copy, Donna.
What is that, Donna? What is it?
Donna, come through.
What is it? Oh my God, this is my
Donna.
So what was it, Donna?
Y'all want a copy of this?
Yeah.
What is it,
How you
Donna?
gonna make
I can't make copies of it.
What is that?
What is it?
It's just three.
Donna, let me see.
Y'all have it.
Come here.
What is that? Copy of that press?
Donna's in her debate.
Let me see, which one is
What was
that?
the answer?
It says unfortunately, but I don't think-
I don't got
What
this.
did you need to stop blood thinners?
Maybe.
I don't-
Yeah.
That's
why I asked you.
It was in the book though, since I.
That's why I was like, let me ask you a
What
question.
did you say? What did yours say?
It said for the lay on the unaffected side and expose the iliac. That's what it said.
I think like for prepping, we're saying like for the process, yeah, they're gonna be on the side immediately before they pull it out, so. But you're saying like night before? Yeah.
What was the question?
She asked us that yesterday, she said she wasn't telling us the answer, and that's why I asked her to let it break, we'll figure it out.
What
Oh,
do
Ms.
patients
Robinson,
have
do
to
you wanna
do
make
prior
a
to
copy of this?
Yeah. Let's go on a break and I'll make copies of that for y'all while y'all are on break, okay?
Okay, come on, come on.
And I need to smoke some.
Y'all did good. If you have questions, when you come back, it's your turn to ask questions.
I will show it all. She paid on me. I didn't know she did this morning.
You're a smart lawyers.
So what? If it's Ashley, you know it's coming.
Thanks, Donna.
Yeah.
Let's do, you on page 1530. Some of it's at the end of the chapter, so I'll just do those. And that's what we come into. Yeah, you can do it lunch. That way you'll be done with it. I got a list I gotta keep up with, and I'm over it already. I'd rather get it done quickly. Okay, let me go make copies for y'all. You will. We're in NCLEX boot camp the next 10 weeks, I promise you. I'm fixing to pull out that NCLEX book and we're gonna take class time. We have beat this up.
in predictor boot camp.
Yes, that's what we're
Do
gonna
you
do.
know if there's a predictive boot camp you can enroll in? 'Cause,
They come, I think they came last year, and like a lady that comes from ATI, and that's what that live is. She comes and she does 3 days of
What is
reviewing.
that supposed to help us pass?
I mean, they did well.
Well, see, we only get 2 days. We only get the 3 days, but I only get 2 because.
Why?
That's not fair.
And she was good. I hope it's the same lady, because I sat there and listened to some of it. Like, she explained fluid and electrolytes, she explained ABGs. She was good.
So they
it
did a
helped.
little test and then they did the 3-day live and people were, there was like a 30-point difference.
And they jumped up.
Wow.
Because it's 3 intense days. But that's what we're doing. I mean, it's intense.
So we just listen to it.
Yeah, and then ask questions like if something's still murky, because sometimes like I got it straight in my head the way I understand it, that might not help you, and I keep telling you the same way, it doesn't help you, and then you get a new person to come in and she explains it, and it's like, oh, I get it, because she has a different explanation or way of explaining it, you know what I mean? So that's why they pick somebody different at the end, so that anything that's still not real clear or murky, she comes in and explains it, and then if there's questions, you can ask. And she was
So they do
just
their
super.
first predictor.
Time we got is
11:30. Do what now?
I said that they give you your first predictor and then
I can't remember what's on the syllabus.
Yeah.
That's
just
what
like
there's
for
that
an
that
order,
way
they
you can
jump,
take the
you have to
second.
take it first.
And, you know, yeah. What did you think about the first time? Was it like difficult? Is it harder than
I
I
think
thought?
you have to do it because I didn't really think like I was like,
Yeah, it's serious. Because that's your your baseline. Here's where you're at. So then you really realize what I gotta work on. If you understand this part, you did well on this section, don't keep reviewing that. Go to the stuff you don't know, you know, and kind of get that clear in your head. Cause what you already know, that ain't gonna change, you know that, you understand that. Go to the parts that don't make sense and work on those parts. And that way you don't waste your time, you know? But, yeah, they did really well that way. Did you like her? Did you go to that ATI? She's an older, I don't know if they're the same one, but she's an older nurse and she was, yeah, she was like really, I was listening to some of it and I was like, oh, that's a good way of explaining that. You know, like I learned some stuff that was murky to me. I was like, oh. So, anyway, I'm gonna make y'all copies real quick.
Remember, right?
Okay, which of the following conditions most likely explains the need to reduce tree goods? Study.
I don't know, Jane, could you pull this through? Yeah. I was looking at my phone, so I didn't know.
Oh,
Well, it is.
Can a Commonwealth college student
I don't remember.
which information I'm taking the client's dietary history and their plans for applying the consideration of which food group has most significant contributed
They were up there?
meat. She's important for the food to not rest day. The nurse provides the attention on this medication a lot of times should be stopped for 5 minutes past the taste.
I am sweating.
2 hours after.
Those questions?
I
Where did
told
she
you
get
the
them?
wrong,
Oh, I was gonna say, we're not even
the
covering that.
wrong section of the thing.
I promise you.
But this is 50 through.
For a
the
bone
rest of
marrow,
the
all you
package.
do is like, I think it's what the question would be, it's just so specific, where you just stop all the letters, you don't want any surgery. You already been more than you don't want to go to the surgery and do more. You know, NCOs and midnight or before. She's taking us down that side. Maybe that's what she's meaning, like to prepare for the procedure. She's trying to find out if you know where they're gonna get it. Remember, it's iliac crest or
I'm sure it is because she was saying.
because that's where
She just
have you ever seen a steak and how it's cut and it's a round bone in the middle of it? That squishy stuff in the middle of the round bone, that's the bone marrow. That's where the red blood cells are. So they drill through, pull it out with a needle. So it's in long bones or iliac crest. Okay.
The first one was over what?
Like the whole book, basically the whole book, right?
I know the
That's
sickle
what we're all
cell
about.
crisis. No, I know the
They're severely in pain, they're cramped, they're dehydrated, they're running fever, and so that's made them sickle cell crisis. Now they're dehydrated and they're really clumping. So all of their tissues are getting oxygenated really.
my mom had blood cells above an 8 or something. Would it even come out to them?
Yes, you know, you have, they're
Like
like,
they
they
have
have,
a hemoglobin of 8.
yeah, cause hemoglobin rate, that's
they're low, they're low. They don't have enough oxygen here, so the first thing is get them oxygen. Try to get them built up, like Irish foods, they might wanna do a symptomatic or live living. They've already done that. Educate them on foods that are gonna build up their iron. Because iron is build, do what? Oh, yeah, they're low, so they're symptomatic, you always give them oxygen.
What are all the main functions of the spleen? She said it would be a sore and all
All the main functions of the spleen. Okay, it's a reservoir for blood. It collects part of the lymphatic system, so it'll collect a lot of immature red blood cells or blood cells that are already like have played out, they're dead, they're about to die.
So it collects immature red blood cells.
Immature red blood cells, old red blood cells, any kind of blood cells usually.
It holds up to like 500 to 800.
Helps with, immunization, like immunity, so it's part of the lymphatic system. It's kind of like a filter. So, look in the book in there. I know it's in our book, because I remember seeing it.
She even asked the highest priority for bone marrow transplant. So I don't know. Yesterday and then 11 on Friday.
Oh, there's Von Lily. I should have asked y'all about Von Lily.
My schedule. So today is Friday, right? Yep, 8:30 to 11.
Shantasia, we'll be okay. We'll get off 3 days.
And then we go to Miss Wells' office.
We'll get off 3 days of a lot of diseases. We'll be out by then.
Yes, Mills River that place.
Are you out of our,
She gave me her card, but she's not taking it.
She is. I think 6:30 to 5. Okay, so we're gonna be out.
I did that. That way you rest yourself. Well, here's bone marrow transplant on page 1502. And then to be.
Yeah, so you're not gonna.
Those who are immunodeficient, who do have cancer, leukemia, and current aplastic anemia. So if they're severe enough, cancer, leukemia, which is like, the low white blood cells, so they can't fight off infection.
So I think that's what she has the highest priority.
But they're extremely low, high risk for infection. So they would have them on like isolation, to keep them safe. Pathogen-free environment, which is isolation. Immunocompromised patient, place this in community isolation. Isolation because they're high risk. Kept in an environment that protects them from being contaminated by others. Monitor for fever infection, because if they start running the circle, they can't have their.
Is the library staff where our classicers or? Yeah, that's why I was
Low immunity slash chemo. Knocks out all of their blood cells. Yes. That's why they're,
That's exactly what class is like.
So maybe that's what she's getting at, is my patient.
That's exactly right.
Bone marrow transplanted.
I was just trying to get to the point.
Youthful aspirations of a general spinal anesthesia. That's just like the cost, says up in there, they're taking it out like we talked about.
Yeah, that's
Leave that part out. And then splenectomy, I know spleen is in the beginning.
We always get So either we're gonna lose it.
It's like, I don't like the body's back. Those aren't even really trying to take them out, so then my body needs to be fresh. I need to function, you gotta have another function, so you already follow. Stores on the sides, which white blood cells on all sides of the rest because it's the right piece of plasma. And white blood cells are the lining of the feels like I'm not you got to. Maybe find a car. They not doing it, it's clean car. Star. Okay, we're on the right track. She doesn't know. She doesn't. I don't know. I was like, what? I'm gonna do this.
Chelsea, you
Really charged my phone last night. It said 100% today.
say how next time I'll bring it for you. I love mine.
I got you.
No, they. I won't. You only think it access to block. Okay, wow. It's not 11.
Is break at 11? I thought so. Is it 11 or 11:30? 11. I'm gonna take this chair too. It's hurting my back. Here's what Miss Donna had. I made copies for y'all. Just pass it around. I love this bed. Sugar. Water.
Have y'all done your post assessment for ATI? Did y'all do that one? Is that's have it due by next week, right? Says on here due. Don't forget to do your post ATI assessment. It's due by the 26th.
What's
The post ATI?
You got a question?
Is that the question she? So has she already sent them? Yes. Okay, don't forget them. They're due next week.
I gotta do that.
Monday by 8.
Yep.
New thing.
The 26th, whatever day that is. 26th.
Michelle's never going anywhere instead of answering my question. I'm fine. She had no time to come around, so we just have to leave before my cousin.
Neutropenia, did you hear about that?
I don't know what she's trying to say.
I don't either. And Maria like, what? Why?
This class and my level 1 were on the same stuff. Because they're doing, basic anatomy, physiology, so we're talking about the cells. So I forget what I tell them and work it out, get their bodies like that. I'm starting them young. I mean, we are going over everything now, cause I said you're gonna need it in level 4. You'll know it by then.
On my phone.
Yeah.
Okay, did we ever neutropenia? That was on your syllabus, and I don't know if she had a question, but I just wanted to make sure you understood it. Neutropenia, small amount of neutrophils, and remember neutrophils are on that breakdown of what the white blood cells. There's two categories: the granulocytes or agranulocytes. Granulocytes are within the cell, and agranulocytes, I think I might have that backwards, are on the outside of the cell. Okay, hold on, let me get my notes.
It was the neutrophils, the E1.
The eosinophils,
The basophils.
they're all white blood cells, so you just remember white blood cells help with infection. Okay? So neutropenia means you don't have a lot of white blood cells. Neutrophils. Okay. So white blood cells, they have two categories. Granulocytes, which are in the interstitial space, they're floating around. And then you got the agranulocytes or non-granulocytes. They do not, they stay within the vessel. Okay?
And on this paper.
That's all on page 1491. Here, let me show you. It's murky. Page 1491.
Do anybody still need the chapter review for 46? Well, that's extra.
Do we get Sam one?
So neutropenia, remember, it's a white blood cell, the first line of defense. So if your neutrophils are low, are you gonna have a good immune system? No. It's usually caused by nutrition, like they're not eating right, like they're not getting their vitamins, deficiency, in that kind of like genetics or chemo. I don't know how much she's gonna focus on chemo for the test, so just know that if you're taking chemo, it knocks out all of your cells. Causes what? Pancytopenia. Good. Lab, remember that you're gonna check a white blood cell count with the WBC with diff. Remember, the with diff is where all the little subcategories of the white blood cells are. Yeah, FF, differential. Okay. There's usually, for neutropenia, there's usually no symptoms. They just kind of come in and they just don't feel good, like they've had a cold or whatever, fever, chills, sore throat, and a lot of times they get passed off as just fever, chills, or sore throat, like a cold. And so until they get really, really sick and really, really low, that's when they catch it. So we just want to continue to monitor their lab work, that CBC with dip, control their temperature with like Tylenol, ibuprofen, things like that, and then just kind of monitor them. The doctor usually say come back each month, and they'll keep checking each month. Okay. Now she asked earlier about where's our cards? The spleen. I think y'all had a question yesterday, maybe about like the functions of the spleen, and we found that answers on page 1495. It tells you what the spleen is and then what it does. We talked about it, it's kind of a reserve tank for blood cells. But remember, it also collects stuff too. It's part of the lymphatic system, so it's going to collect all the germs and things in your body. It realizes when those red blood cells that are old and not working anymore, it collects those and kicks them out because you need new fresh ones to work, right? Your body needs fresh ones. So those functions are on 1495 and 1496. So that may come up, functions of the spleen. And remember, they'll do a splenectomy if you have what? A clotting issue, right? You're not going to clot, so they don't want you to have a spleen because you'll bleed to death. Okay? And then what was our last question?
Highest priority for bone marrow.
Oh yeah, highest priority. Who's the highest priority patient for a bone marrow transplant? Who would be the person you would think that would be at the top of the list for bone marrow transplant? People that are on chemo or have some type of cancer, because the chemo is knocking them out, all of their immune system out. So low immunity, chemo patients. What else was in there?
with those patients, just, be sure you keep them in the pathogen-free environment.
And if they're about to have a bone marrow transplant or aspiration, keep them in isolation. Remember that? Reverse isolation. We as nurses are carrying germs even though we're healthy. We're gonna go in a room that we've just been down the hall and another patient, they were sick, and we go in the room with our chemo patient who has low immunity. Can we make them sick? Yeah. So they're always gonna be on isolation if they're about to have a bone marrow aspiration or transplant. If they start running fever, can they have that surgery? Nobody with fever can ever have surgery. They have to postpone it. So if they have fever, that means they've got an infection, right? So we gotta wait. So look for those things on your test. Might be one of those select all and apply things. Watch for fever. Keep them in isolation. Do all your universal precautions, hand washing, gloves, gown, whatever kind of isolation they're on, okay? Think like that. Like if that was somebody that's severely immunocompromised, what would you do? You protect them, okay? Any questions on anything? Feel good about it? Y'all have done really well. I think y'all have a good grasp on it. Look over your stuff, focus on what's on the syllabus. She kind of tests on that syllabus. Okay?
Thursday,
Yeah, we'll do. Did y'all decide y'all want to do ATI Thursday morning and then your test Friday? Is that what y'all decided on? Okay. So maybe Thursday we can do a quick review there. Alright. Y'all can just kind of stay here and then ease on out at your time, okay? If you have any questions, I'll be up here.
So, it's just
Yeah. Y'all have to be back at 12 for Miss Nesbitt, right? So yeah, 11 to 12 is your lunch break. There's one up here, so please. Got one?
The reading assignment is good, but it says that we covered chapter 3. Also, like, right
Did
away.
everybody get a copy of that stuff that Simon gave y'all? Review. I don't know if that should be on there or not, but.
A lot of it should be so on the yeah, but it was yesterday, and there was some stuff off of chapter 3.
Regina, didn't it say it was for in class? Who?
Three.
I missed one.
It's two all together, but when we read it's 4 and 5.
Exactly.
Right, it's a reading assessment, it's what happens, reading assessment, it's a video over 4 and 5. Right.
Let's write it down.
But no, the stuff that.